Dear students, today we will discuss a clinical case with the imaging. Clinical case with the image will give a combined diagnosis, so that it will be very useful to go ahead with your further method of treatment. Now, before discussing that, we will have a quick MCQ. The herringbone pattern with the concertina effect is seen in obstruction of A, B, C, D. Put the right answer in your comment box. I will acknowledge, appreciate your answer and put the right answer in 24 to 48 hours. Diameter of small bowel in imaging which suggests intestinal obstruction is if more than A, B, C, D. Put the again right answer. I appreciate your answer. Put it in the comment box. Now, before starting the discussion, students, please subscribe my YouTube channel. It is free, and share with your friends and colleagues, and upgrade your surgical knowledge on day-to-day basis, and also join live session once in 2 weeks, which give extensive discussion of different clinical cases with the other faculties also online. It will be very helpful to learn detailed discussion for more than 1.5 hours. And also, if you join live session, we will get a certificate which is very useful for your future career. And so please again request, join my YouTube channel for learning surgery in the best way. So, what this condition and image is, look at that. Here you can see that large protrusion in the umbilicus, quite big. Patient is having pain, vomiting, tachycardia is there, distension is there, patient can't pass motion. So that means it is obstructed umbilical hernia. Take a plain X-ray abdomen in erect posture, you can see the multiple air fluid levels. That means there is obstruction, bowel is getting adherent here, maybe with the momentum. So here treatment is, you have to open, release the adhesion, confirm that the bowel is viable or not. So many methods are there: oxygen, indigocyanine, pulsation, on table Doppler, then put hot mop. So many things are there. Of course, if it is not viable, reset and do anastomosis. If it is viable, reduce and put it, and if there is momentum, remove it, then do a repair. If it is inflamed, do a mesh repair tool, which you prevent the recurrence as such. So this is obstructed umbilical hernia, or otherwise called as ventral hernia also. So plain X-ray abdomen here, which is showing the multiple air fluid levels, suggests intestinal obstruction. Also, it suggests that surgery should be done as early as possible to avoid bowel going for gangrene, which is risky, which requires a resection, anastomosis. Prior to that, you can always do a CT scan, even the plain CT scan sufficient to confirm there is obstruction, which is more sensitive and specific than plain X-ray abdomen as such. So please go through my manual of surgery with the intestinal obstruction chapter, which gives a very detailed concept about intestinal obstruction, management, complications, problems. Remember, commonest causes, 2 causes which you have to remember when you think about the intestinal obstruction. One is hernia, second is adhesions. The 2 are the commonest causes. Other than that, of course, you got intersection, congenital anomalies, volvulus, growth, different malignancies, tuberculosis, stricture, so many internal hernias, so many conditions, round arm obstruction comes in picture. But 2 conditions: one, hernia; second, adhesions. These are the 2 conditions which are more commonly causes intestinal obstruction. Of course, other conditions I already mentioned. Remaining detail about, please go through my manual of surgery. So, quotation of the day is: behavior is always greater than knowledge. When knowledge fails, behavior can handle. This very important quotation. Behavior is very important. Wherever you go, social, system, professional, anywhere, that is what exactly it says, very useful to surgeons. Again, students, I request you to go through my clinical methods in surgery, which gives detailed examination of all topics: general, hernia, thyroid, breast, varicose vein, perivascular disease, ulcer, swelling, abdomen, rectal examination, urology, specialties, briefly orthopedic, then instrument and specimen, but no management, only clinical method. Each chapter has got a QR code. If you click, you get a video examination of each chapter, like hernia, breast, thyroid, vascular disease, and so on. Lot of photos to identify different clinical conditions, very useful. Methodically explained how to examine a patient, the basis for surgery, so that you can step up for in surgical career, very essential clinical book as such. My manual of surgery is extensively used all over the world. It covers everything as per CBM syllabus, from general surgery to specialties with the gastro, with the urology, neurosurgery, cardiothoracic, breast, thyroid, peripheral vascular disease, varicose vein, endocrines, everything is covered with the footnotes, with the investigation, management, tables, policies, principles. With each chapter has got online link which gives a lot of MCQs with also case scenarios. Very, very useful to face all exam as far as surgery is concerned, to learn subject also, and also to face exam because lot of MCQs are there online. So please students, have my manual of surgery to have a best knowledge about surgery also. Also have refer my operative surgery book to volume to learn surgery step by step, small minor surgery to major surgeries, and also my atlas of tissue approximation, small book atlas with the video how to do the suturing with the principles, with the video explanation. So again students, my DigiNow lecture is there through JP Publisher, around 220 hours, covers everything about surgery, theory, practical, operative surgery, examination, clinical examination in detail. So I also have, you can purchase that one through JP Publisher for 1 year. We can really hear and understand the subject easily to face the exam properly also. Again students, subscribe my YouTube channel, share with your friends and colleagues, have a best knowledge of surgery on day-to-day basis with the brief lectures daily and also live session once in 2 or 3 weeks. So students, I hope you have understood this lecture very well. Thank you so much.